some women can benefit from pelvic floor physical therapy. If they find challenges doing Kegels on their own, a lot of people are even beginning to think that that should be a standard aspect of the postpartum period to see a pelvic floor physical therapist. And so to help coach women on how to do those exercises most effectively. And so I think that would be key for women to begin to do. They don't have to see a urogynecologist, although there are some women, depending on their insurance, if they are using insurance, that see me first and I tell them the very same thing. But that conversation naturally should happen with the person, your gynecologist or your obstetrician who delivered you, your baby.
Okay, that's great. So definitely the first place to start is pelvic floor physiotherapy. So let's say, for example, a woman has been doing pelvic floor physiotherapy for about 3 or 4 months, or
Right.
even like 5 or 6 months, and things are not really improving. There's some issues with leaking. Things are just not the same. What would be the next steps that you suggest? Should they just continue with physiotherapy? Like, is there a timeline when they would say, I need
Mhm.
a little bit more intensive? What are your thoughts?
Yeah. So there's definitely evidence that it takes at least 3 months of consistent pelvic floor muscle strengthening before reaching some sort of a maximum benefit. So I would say 3 to 6 months. But during that time, a woman is recovering from having delivered her child. And I think that it's still a reasonable time to give women between 3 to 6 months of consistent pelvic floor muscle strengthening and bladder retraining. If after 6 months there's no change, then I would say, okay, that would be the point where seeking a specialist is helpful.